acid reflux program at McAllen Medical Center offers innovative treatments that can reduce chronic heartburn symptoms as well as chest or throat discomfort.
The acid reflux of the heartburn is when you eat something spicy and then all of a sudden you hurt, or you have this sensation of tightness in your chest and sometimes even a little bit of acid reflux. That is the typical part that we all know.
Gastroesophageal reflux disease, also known as acid reflux disease, affects about 20% of the U.S. population. But here in the Valley,
it is said that about 60% of young adults at some degree suffer from reflux. And two reasons here in the Valley: because of the diet that we eat, and second, unfortunately, the Valley has one of the highest incidence of obesity, and obesity is related also to reflux.
While over-the-counter medications may provide some relief, there are over 1 million people in the U.S. for whom no amount of medication will provide relief.
And that is why sometimes people that either don't respond to medication or are not advised to keep that medication for a long time, they're recommended to have surgery if they're candidates.
If left untreated, reflux may lead to respiratory problems, ulceration of the esophagus, and even esophageal cancer.
The mechanism where the intra-abdominal pressure increases the fluids to go up instead of down, and people that have probably mild reflux, after they gain weight, it becomes severe reflux that in the future may become cancer.
You can get relief without surgical incisions. The procedure is called TIF,
which is a transoral incisionless fundoplication. It is a fundoplication, but that instead of being surgical, we just place a flexible scope down through the mouth, go down to the junction of the esophagus and the stomach, and then we bring it down, folding it, placing some special clips around to create that valve, to create that pressure that will prevent the reflux to happen again. And it has been as successful as the surgery with less complications.
TIF is a less invasive procedure that does not require internal incisions or dissection. Most patients are able to return home the next day and return to work and normal activities within a few days.
This is a procedure where the patient comes in the morning through general anesthesia. We follow the procedure, goes to an overnight state. In the morning, they eat and then go home. In 1 or 2 days, they can go back to work, contrary to where they will have had surgery.
So if you're looking for a safe and less invasive remedy to your acid reflux, count on Dr. Reyes at South Texas Health System.
People don't need to go to San Antonio or to Houston to have this done. And here, McAllen Medical has all the equipment necessary to perform this procedure. We're here to try to help patients to get back their lifestyle.